Hey team, welcome back to another episode of the Student Paramedic Podcast. Hey team, welcome back to another episode of the Student Paramedic Podcast. Today is Season 2, Episode 1. I cannot thank you guys enough for an amazing Season 1 and all of your support. For all of those who have left a rate and a review on Apple, thank you so much. Particularly Kat for Paramed and Matt Howie, thank you for your feedback. Really appreciate it. So today's episode, we're talking to both Darren Hodge, who's a MICA flight paramedic who we met back in Season 1, Episode 2. And we're also chatting to Jess O'Brien, who's also an Ambulance Victoria Paramedic. We're going to have a chat to them today about how they cross paths and experiencing emergency care on the other side. So thank you both for coming on today and sharing your stories. Jess, would you like to introduce yourself to all of our listeners?
Yeah, sure. Hi, everyone. I'm Jess. I'm a paramedic and I work in Geelong. I've been a paramedic for just over 5 years now. And recently I had an experience where I was on the other side as the patient, which was, quite, obviously I wish that it didn't happen, but it was quite an interesting experience and gave me some new perspectives, which there has to be positives out of any negative story. If you look hard enough, you'll find them. And I've definitely found a few that hopefully I'll be able to take back once I start back on road next week.
Jess, would you mind sharing your experience?
Yeah, sure. So I was diagnosed with an ectopic pregnancy in, I think it was mid-Jan or maybe early Jan. And I was being treated for that with methotrexate, which is a drug that they use to treat ectopic pregnancies. If your HCG levels are under a certain level, they can use that drug. It's actually a chemo drug, for those of you that aren't familiar with it. I wasn't before I had it. And once you get given that medication, they then check your HCG levels on day 4, day 7, and every week to make sure that they're dropping appropriately. With the idea being that the pregnancy or the pregnancy tissue will absorb back from the tube into your body and be reabsorbed. That's kind of the ideal and what hopefully happens. And for me, everything was going great. All my levels were dropping as they should be. And then I was away in Apollo Bay for the weekend because unfortunately my dad also had cancer and had passed away. So we were in Apollo Bay burying my dad. That was on the Friday. And then on the Sunday, I woke up with some pretty bad abdominal cramping. But I actually originally just assumed, because my husband had been sick the day before with what we now know was food poisoning, but I just thought maybe it was gastro and I was getting what he had. And I remember clearly thinking that morning, Sunday morning, oh gosh, I didn't give him enough sympathy yesterday. Like, these are bad cramps, way worse than what I would normally associate with like vomiting and diarrhea. And I just remember thinking, oh God, I wasn't nice enough to him yesterday. Anyway, I was in the back room of our farmhouse that's out there, or my parents' farmhouse. And I just kind of spent the morning in bed trying to stay away from the rest of the family because we were all there together to bury Dad and I didn't want to make everyone else sick. And the pain just kind of kept coming quite strongly and then it would go away for a while and I was able to sleep. And then I had to get up and go to the toilet. I think that was about midday-ish. When I tried to get up, I just collapsed and then managed to get up and walk out of the bedroom to the kitchen where I could see my husband sitting in the lounge room. And then I yelled out for him because I was feeling pretty dizzy and had my second faint. And then my husband got my mum and called her in, and mum said, I'm calling an ambulance. And I said, don't you dare. I remember that very clearly. I remember saying, like, I will not be the paramedic that goes in the ambulance for gastro. Like, that is ridiculous. I just got up too quickly. I need some water. I'll be fine. And mum said, fine, if you can get up and go to the toilet, like, then I won't call an ambulance. So I got up and that's when I collapsed for the third time. And then mum was on the phone to the ambulance when I kind of came around this third time. And I said, like, again, thank goodness my mum didn't listen to me, because I said, no way, like, I'll just get in the car. There's a GP in town. Maybe I just need some fluids. Like, there is no way you're calling an ambulance. But by then, mum had chosen to ignore me, which I'm very grateful for now. And it was in the back of my mind that, yes, maybe it could be the ectopic pregnancy, but I was being pretty stubborn, I suppose, a little bit pig-headed. And just, I suppose, the idea of being a paramedic as a patient, if it was just gastro, was so mortifying to me that I couldn't accept the idea that maybe it was something worse than that. Anyway, by the time the ambulance arrived, the pain had gotten significantly worse in that, say, 10 minutes. And I was doubled over in pain by the time they got there. They were amazing, of course. They tried to get an IV in and unfortunately couldn't, because I was just like so hemodynamically collapsed by that point. So they took me to the local Apollo Bay hospital, knowing that a nurse practitioner was on there who only does one weekend a month at the Apollo Bay hospital. And I'm very, very grateful that she was on, because she was clinically amazing. But on the way, they gave me some iron ketamine for my pain relief. Now, I haven't had much exposure to any pain relief before, little bits and pieces for various things, but nothing significant. And the iron ketamine knocked me around a lot, way more than I had ever anticipated. And I'll definitely be, I suppose, thinking a bit more about it before just giving it out to patients as easily as if it's, any pain relief, because it did help with the pain, I will give it that. But it made me so dissociated to everything that was going on, and I hated that feeling. So much so that, like, in the back of the ambulance on the way, it's a dirt road where we were, there's trees, and I was seeing like multiple trees. And I remember I kept asking the paramedic why I was on the bed, like not treating. I was like, why am I laying on the stretcher? Like, what is happening? It just made me completely dissociated, and I hated it. I really hated that feeling. And I remember they asked me what my date of birth was, and I just said, oh, like I was born, like I was so drug affected that it was, for me, quite horrible. And I do remember the paramedic saying, do you want a second dose? Because my pain was starting to come back a bit. And that was the only thing the whole time that I refused and said, absolutely not, do not. Like, I would prefer the pain than that feeling that the ketamine gave me. Anyway, we then arrived at the Apollo Bay Hospital. They put some IVs in, I think 2. I was pretty drug affected at that point, but I'm pretty sure they put 2 in. And they actually did that outside the hospital, because the day before, when my husband was sick and I'd had a bit of a runny nose, so we'd gone and gotten COVID tested just because it's the right thing to do, and I was due back at work on Monday. And so they didn't want me to go into the hospital because I didn't have my results yet. And the idea was they were going to put the IV in and then put me back in the ambulance and take me by a road. But after they got the IV in, the ambulance actually got another call for an unconscious patient. And I do remember clearly saying, like, I'll be fine, like, just leave me, I'll get off the stretcher, I'll be completely fine, go to the unconscious person, like, I'll be completely fine. Anyway, so they took me inside the hospital and they went off to their other job. And according to Mum, I can't remember that 10 minutes of being in the hospital particularly well, but according to Mum, it was about 10 minutes later that my blood pressure dropped to 60. My heart rate was sitting at about the 140 mark, I think, from what Mum remembers. And I do remember them saying quite clearly, oh, her blood pressure is 60 on 40. And I was laying there and I was like, oh, it must be the ectopic pregnancy, I'm sick. That wouldn't be gastro. And it's quite funny from a clinical point that it took that before I went, oh, like, I am unwell. And Mum was quite worried about how that affected me. And Mum was saying, no, like, she knows what the numbers mean. Don't say them out loud. But that was worse for me, which I did tell Mum later. Like, for me, it was better to know. Like, I wanted someone to tell me what was going on. Being kept out of the loop was much worse. It made me more stressed. Whereas when I knew what was happening, that made me feel a lot more, even if it wasn't great news, it just made me feel a bit more in control, I suppose. I suppose coming from a point where I'm used to being clinically, not always in charge, depending on, who's there, but clinically involved and on top of it clinically, to then have that taken away was quite a weird thing for me, relinquishing that control, I suppose. It was quite, just odd. I guess it's just not what I'm used to. And then they organised the helicopter. I have vague memories of, like, those conversations and those phone calls while the helicopter was being called. And I do clearly remember Mum saying, like, this is taking too long, I'm just going to drive her. And them saying, no, you cannot just drive her. Like, it's all being organised, everything's fine. The helicopter is on its way. They then got a community officer team to come and pick me up from the Apollo Bay Hospital, because the other ambulance was obviously out on their other job, and to take me to the football oval, which the clinical nurse came in the ambulance with me. And then we arrived at the football oval, and I do remember her saying there'll be lots of people watching. And me thinking, oh, yeah, of course, like when we were kids, we always watched the helicopter coming and land at Apollo Bay. We've spent many holidays at Apollo Bay. It's kind of a family place that we go a lot. And just having a new perspective on that too. I don't think I'll be sitting and watching a helicopter over again. Just because it's not like, that's not fun for the patient. I mean, it didn't really bother me too much, but it's not fun for the family. My poor mum had, there was kids waving and cheering and being excited about the helicopter. And, for mum, it was her, she knew how sick that was because she is a nurse. And yeah, for her, it might be, she's just buried her husband and now she knows how unwell her daughter is. So I do have a new kind of perspective on the fun waving and watching the helicopter. For that family who's going through that crisis, that's not a fun situation. And yeah, that's when I met lovely Darren as well when the helicopter landed. And I do remember him coming in the back of the ambulance, and it's funny what's clear, and some parts are clear and some parts are so blurry. And I remember him leaning over me and saying, "Hi, I'm Darren," and me going, "Wow, he's really leaning over me," and then going, "Oh, thank goodness," because otherwise I'd have no idea who he is because I was so disassociated. By then the ketamine was starting to wear off, and I do remember feeling as it wore off just the biggest sense of relief. Like I've never been so relieved in my life to feel it. I was like, oh, I can feel it's going and I never want that ever again. And he did an ultrasound of my stomach, and I remember him apologizing that it was going to hurt when he did the ultrasound, but I think I was already in so much pain that by that point it didn't even matter. Then they loaded me into the helicopter and gave me some blood. And my husband said that Darren asked him if he was squeamish, and my husband's not, and he said no. And then my husband was holding the blood bag, which for him was really good because it gave him, he said, like, this is according to my husband talking to him later about it, it gave him a role and something to focus on. He was like, yep, I can hold the bag. Like, it's not a very difficult job, but that's something I can do, and it gives me something to focus on other than the fact that my wife is about to go off in a helicopter and is very sick. It just gave him, it's such a simple task, but it just we're all taught, I suppose, giving family members on-scene tasks can be a really good way to keep them busy and helpful without getting too in your way, I suppose, or too, I don't know. It's just we're all taught always that giving a family member, if they're an appropriate family member, a job can be really helpful. And hearing that from Brendan afterwards, how helpful that was to him to have as simple of a job as holding the blood bag. And then my memory is a little bit patchy of the helicopter flight. I do remember, I'm not a huge fan of flying. I don't completely hate it, but I don't love it. And I do remember continually saying, like, please don't crash and I don't want to fly. And it's quite funny, I suppose, when things are going, not in a good way, the things you focus on, because yes, I don't like flying, but also I've been over on holidays and things without ever whinging about the plane crashing. So I suppose that was just the thing that I could focus on, because maybe it was a little bit too hard to focus on the reality of everything else that was happening. And I do remember asking my husband where my son was. I also have a 2-year-old, or nearly 2-year-old, but he was being very well taken care of because there's plenty of family at Apollo Bay for that weekend. And then on the way, I do remember wanting to look at the view and trying to sit up, and Darren saying, probably not, let's not sit up. And so he took a photo for me so that I could see the view. And I do, it's funny what's clear in your head. I do remember thinking like, oh yeah, I actually am in the helicopter, because it all happens so quickly. And I suppose I'd gone from a point of thinking I probably had gastro to realizing I was very clinically unwell. It takes a while for your mind to catch up. And then I do remember when we landed, like when they were taking me out of the helicopter, looking around the helipad on the roof and thinking, I've never been up here. Like I work at the Geelong Hospital all the time, but I'd never been up to the helipad. And I was like, oh, it was pretty cool, actually. I might have to come look at it when I'm less sick. And then I do in ED. I remember when they were chopping my clothes off and me thinking how ridiculous. I can get out of my clothes myself. And I was that annoying patient that's like, yeah, I can just take my top off myself. It's like, no, just let us cut it off, will be easier. And I've always thought when I've been treating people, like, how ridiculous, you're so sick, who cares about your clothes? But as a patient, it's very different. I suppose I was like, no, I can do that myself. It's something I can control. Which I couldn't, by the way. They did chop my clothes off. I was far too sick to sit up and take my clothes off. But yeah, it's just funny the things that as a paramedic I thought were so ridiculous that patients were thinking about. And now as the patient, I was thinking about the exact same things. I have no memory of them taking me up to surgery, but my obstetrician, who is amazing, did say I talked to her the whole way up, but I can't remember that at all. And I do remember just before going into surgery being like, I'm very sick, but I'm going home and seeing my son after this. This isn't going to be, this is definitely not the end. I actually remember clearly thinking that as I went into surgery. And then that's it. Then my next memory is waking up in recovery, which is that memory's pretty hazy, but I just remember waking up and I was still in quite a lot of pain, and I hadn't expected that. I'd kind of thought, usually after surgery, you're quite dressed up and you're not in that much pain. And I was like, oh, where's my nice tired feeling after surgery? Why have I still got all of this pain? But my abdomen had so much blood in it, they ended up draining out nearly 4 litres. So obviously that takes time for that to settle. It doesn't happen instantly. And the other pretty amazing part of my surgery is that my obstetrician, who was my obstetrician with my son, Archie, as well, and has been my obstetrician through, I also had a miscarriage in October last year, so she's been through all of that, and now the ectopic pregnancy as well. Anyway, she was actually at home on a day off, and the obstetrician that was on call at Geelong Hospital called her and said, I can only do this surgery as an open surgery. And she said, I'm coming in. And she just dropped everything she was doing and came in because she could do the procedure keyhole, which is a significantly smaller recovery in comparison to a full open surgery, and also lower risks associated with it. So I'm so grateful to her as well for doing that. She's pretty incredible. So I just feel very lucky. I had an amazing team of people, and I had so many different people, and it really shows, as a paramedic, you're often a very small part of someone's journey, but you do get to contribute to it. And for me, it just showed how many different people I had that contributed to my journey, and to me making it out the other side and being here doing this podcast with you today and starting back on road next week, which could have had a very different outcome if anything had gone differently. From the very start, Mum not listening to me and calling an ambulance. Thank goodness she did that. Otherwise, I'd still be in the back room of the farmhouse at Apollo Bay. To every single paramedic, and then ultimately surgery, and all of the nurses that were involved as well. It takes a lot of people to have the outcome that I had, and they all did an incredible job. I'm very lucky that I had the system worked for me, I suppose. Everything went the way it's supposed to go, which resulted in me, having a great outcome, really.
That's an incredible story. It sounds very confronting and very upsetting at the same time for you. Now, we're lucky enough to have Darren, who, as you said, was there with you. And I want to get your perspective, Darren. What was going through your mind when you were there, and what was that, I guess, clinical perspective as well?
I think firstly, such kudos to Jess for sharing her story. I don't think we as paramedics hear enough of a patient perspective in relation to drugs and treatments and things like that, and the little nuances about her husband holding the bag and being connected. So I take my hat off to Jess. I think that's brave for her to do that. So at the time I was working at Warrnambool, and we received a call for a young lady who's had an ectopic pregnancy. Sounds like it's ruptured, and she'd been taken to the Apollo Bay urgent care facility where there's no doctor in attendance, only a nurse. I was told that the ambulance was loaded, but they decided to go back because she was so unwell clinically. And I must tell you that I was distressed to hear that, because that does not sound like good medicine to me. But as Jess says, she was very, very lucky on the day in question. Firstly, she was attended by paramedics, and they've cared for her. But they've also, in caring for her, they've also seen a limit in terms of their care. They haven't been able to establish IV access, and they've taken her to see the nurse practitioner. My wife's a nurse prac, so I have respect for them. But as a general statement, it just doesn't sound great going to see a nurse, does it? So, and that's probably a little bit of a lack of respect on my behalf. But she was so lucky that the nurse practitioner that was there on that particular day was exceptional. And in fact, I've been to a lot of hospitals where lots of doctors have been, and they wouldn't have provided the level of care that Jess got on that particular day. So this young lady, the nurse prac actually turns out, I normally work in Traralgon, and I rang up and chatted to her later because I was so impressed with her care. But she works at Latrobe Valley. That's where I normally work. And so amazing. So she established IV access. She saw she was acutely unwell. She gave her 1,600 mils of crystalloid solution in terms of resuscitation, which absolutely was critical at that point. But she also had a very, very good appreciation for multimodal analgesia. So she tried fentanyl, she tried paracetamol, she tried morphine, and obviously she tried the ketamine. I mean, ketamine's an interesting drug, and we can talk about that all day, but in terms of those sort of behavioural problems that people have and the patient experience side of things, everything I've read about ketamine is it's best given with a good base of opiate, so that it reduces some of those bad feelings that people have. Unfortunately, Jess didn't get that, but she did in the end get a very, very big spread of drugs. And when I met Jess, we flew into the hospital there and landed, and it was the hospital, the football oval we landed in Apollo Bay is right next to the caravan park, and it's school holidays. So there are literally thousands of people who want to come out and have a look, and there's a lot of excitement from a lot of kids and stuff like that. So it's interesting hearing the story of the distress that causes to a patient. I'd never really thought about that, so that's interesting. I got into the back of the ambulance and I met Jess, and the first thing, as you approach a patient, you're processing information, and we make a lot of assumptions on a lot of things. And the first thing that I remember when I saw Jess is, my goodness me, she looks terribly unwell. She had that absolute pallor that we associate with hypovolemia. She was slightly sweaty. The monitor's pinging you along at about 140 beats per minute, and the nurse prac has given me the handover, and I'm sitting there being nothing but impressed by all the drugs that she's had. One, that she's awake because she's had enough drugs to kill a rhino, and the other part of it is that she's writhing in pain. So all the analgesia that she's had to date has not been overly effective. So in my head, I'm starting to process how we're going to look at the analgesia, but I want to get through and perform my primary and secondary survey. So we've gone through and we're working through that. I did do an ultrasound series on Jess, and I'd have to tell you, it's probably one of the most disturbing ultrasounds I've seen. She had blood in all 4 views in her abdomen. So to get a positive fast, you need to have 400 mils of blood or greater to be in your abdomen. And in my mind, the fact that I could see them in all 4 views of her abdomen suggested to me that there was a substantial amount of blood in her abdomen. The ultrasound is really just, it's just another building block in the clinical picture. At the end of the day, I didn't really need it. I had no doubt with what was happening, and that Jess had a ruptured ectopic pregnancy. I think part of what was in the back of my mind as I'm processing this is I wasn't told that Jess was a paramedic until I think one of the ACOs, one of the volunteers said, "Oh, we've got to look after this girl. She's one of ours." And I turned to Jess and said, "You're a paramedic?" And she said, yeah, I'm a paramedic. And there was this little moment when I heard that, is that we all have, as paramedics, we all have a little bit of knowledge. We're not experts on anything medically, but we have a little bit of knowledge. And Jess would have known that this is a potentially life-threatening condition that she was suffering. I believe in being honest with people, and that I told Jess that I could see free fluid in all her abdomen, or the abdominal series on her ultrasound, and that that we suspect she's got a ruptured, well, we don't suspect, we know she's got a ruptured ectopic pregnancy. And my priorities at that point were just to get moving, because the only definitive care for Jess is a surgeon. So I was pretty keen to get going. So I'd asked my crewman on the helicopter to get the bed out, get it ready, and there's going to be a few minutes to doing that. And so the nurse prac had done such a wonderful job. I asked her if she could put a tourniquet on and take a venous sample and draw some blood off from just a vein, and we would do a venous blood gas. So in particular, what I'm looking to understand there was see what Jess's HB was. And to my surprise, and again, just testament of how good this nurse practitioner was, she'd already done that. And as I said, I've been to many hospitals where many doctors have been carrying that would not have given Jess the same degree of care that she got that day. So she was exceptionally lucky that the system did work for her. So Jess's HB was 95 at the time. So most of you will know that, some of you will know that for a female, depending on what you read, 12 or 13 and above is considered to be normal. And most blood resuscitation guidelines talk about a HB of less than 10 and probably even slightly higher for females. So in terms of the resuscitation in the person with the obstetric emergency, such as Jess, there's no literature that doesn't talk about how we should approach resuscitation for the pregnant patient in the context of permissive hypotension. So there's just simply not enough data. We don't see enough patients with this medical phenomenon to know what the right thing to do is. So our guideline in Victoria with permissive hypotension is accepting a blood pressure of 70. I personally think that's a little bit on the low side. And given this lack of information with the obstetric patient, I decided to try and titrate a blood pressure of around 100. When I met Jess, her blood pressure had been as high as post-resuscitation had gone over 100. But as I was sitting there and loading it, every time we'd psych a blood pressure, and we were doing it every 3 minutes, without the fluid resuscitation, Jess's blood pressure was continuing to fall. So we loaded Jess into the helicopter. Again, some of the things that, getting a little bit emotional here, but Jess's mum asked if she could come, and I said that she couldn't. And she said that someone needed to be there to look after her, and I promised her that I would make sure that someone was there for that. That's a tough part of doing what we do, but it was the reasons we don't take people in this setting is, one, I was too worried about Jess, and two, sometimes we get our crewmen in the back to perform the resuscitation. So we didn't take Jess's mum or her husband. So we loaded Jess, started some red cell concentrate. She had an immediate response to the blood, and then we were able to resuscitate her blood up and just titrate it based on the blood pressures that we were doing. The other point, of course, was that we needed to look at further analgesia for Jess. She was still in considerable pain and she had received a huge amount of opiates and obviously the ketamine. I continue to give small amounts of opiates, but I also tried Penthrone analgised, and it did work. It did take the edge off, but Jess had to be coached because she was still, I think, dissociated from some of the ketamine, but she's also still distressed. So the trip really was just maintaining that blood pressure around 100 and obviously just getting into hospital quickly. We talked about, before we started, about caring for our paramedics and people within our industry. There's no, look, I'd like to think that as paramedics, we all look out for our patients and we all try and give them good care. As a paramedic, there's no perks. You don't get a company car. There's no discount on a house. You don't get anything other than a free ambulance ride. So Jess was getting a free ambulance ride, which probably didn't mean a lot to her at the time. But I think we just try and go that little extra mile for our paramedics and our staff and look after them. So I'd actually got on the radio and I'd spoken ahead because no one in ambulance knew that Jess was a paramedic. So I hadn't spoken to Jess about this, but I did get on the radio and say that this was in fact a paramedic and that she worked from Geelong and that we could have a manager there present because there was no family there to look after her, and keeping my promise to Jess's mum. Ambulance Victoria was good enough to have a manager there when we landed, and I gave him a handover, and he stayed around to make sure that she was okay, which is good. We arrived at Geelong Hospital. I think Jess, we'd started the 3rd unit of blood and we'd maintained the blood pressure around that way. And another point that Jess made about being informed, I spoke to Jess all the way through and I continually updated her on her obs. It could be only because if I was in her position, I would want to know what my blood pressure and heart rate was. So, but part of that was quite, given the success of the blood in the treatment, I was able to give her good information, and I told her that we were meeting our targets and everything was sort of going well. So that was all really good. And then we went into the hospital. I handed Jess over to the staff at Geelong Hospital and they were on point. Like, there was a big team of people waiting for us. I said to one of the doctors, I said, this girl's one of ours, so I expect that she gets the VIP treatment. And he looked at me and he said, oh, well, we give all our patients the VIP treatment, mate. And I said, well, I want something a bit better then. He had a little laugh and a little giggle, but he got the point, and Jess was taken to theatre. I think about the 16-minute mark of being in ED, she was on her way to theatre. So again, just made the point about the system working for her. It absolutely did. I think the fact that Ambos picked her up, they identified a problem. The nurse practitioner was exceptional. I wrote a letter to the CEO of her healthcare network. I was so impressed by her. I had a chat to her. She's a legend. The helicopter was available. We got there. We had the blood, and to give her, and we could get her to hospital in 40 minutes rather than 2.5 hours. So that worked out well, and she obviously had a good surgeon who looked after her. And here she is doing a podcast for the Student Paramedic podcast. What a legend.
Thank you for both being on. That's amazing. And is this the first time that you guys have both seen each other since?
Yeah, we're going to try and catch up. I'm on holiday soon, so I'm going to try and catch up with Jess and say hello. But it is, so it's really lovely. And as I said to you before we started the podcast, if Jess walked past me in the street, I wouldn't recognise her. This is a healthy young lady sitting before us, and the one that was laying on the bed before me was a very different picture on the day.
Absolutely. And Jess, now looking back, like we said before, you learnt so much in terms of, you know, what you do for your patients going forward, having that experience yourself. You know, what are some of those things that you didn't realise before, but now that you do?
Yeah, I've had, it's been 5 weeks since this happened, so I've had lots of time to think about it a lot, as you do when you have such a life-changing event. And I suppose the first thing is a patient like me would have scared me as a paramedic because I would have known how sick I was. And we're taught, in uni, you're taught an ectopic pregnancy is potentially a life-threatening emergency, and you're taught in a female of childbearing age with abdominal pain, if it's not yet diagnosed, always to suspect the ectopic pregnancy. And it's kind of something that, like, I've never seen it. I've never seen a patient with an ectopic pregnancy other than myself. And it's something I suppose that we're always taught to be a bit scared of in a good way. Like that's there for a reason, so that hopefully it doesn't get missed, which would obviously be not good. But I think a big thing that I learned is if you're going to someone that is trained medically to any degree, definitely don't know very much about obstetric emergencies. The most experience I have with obstetric emergencies are my own, unfortunately. But a big thing is to give them that information, because like Darren said, he was continually updating me on my blood pressure and heart rate, and I found that so helpful. So I think unless someone says, I don't want to know that, I think you should be telling them, because I knew as a paramedic what he was checking, and I wanted to know those numbers in my head. And I think even if like Darren said, they were going the right way, so it was good news. But I think even if they weren't good news, I would want to know, because the anxiety of not knowing would have been worse for me. But I guess that's quite individual and could be very different for someone else. And another big thing is to not discount those roles for the family. I hadn't really realised how significant they were until my own experience. I've always done it in my practice just because we're taught to, and I have found it helpful purely as a way of keeping the family involved and updated with what's going on without them kind of interfering with what you're trying to achieve as the clinician. So that's why I've always done it, but I'd never realised before quite how helpful that would be to the family, because that really helped my husband. It helped him a lot. And just the certain aspects of that emotional side that you perhaps don't really think about as much as a paramedic, like the people watching. Like I said, for me as a patient, it wasn't too bad. I think I was too sick to really care, but that had a huge emotional impact on my mum particularly. That was hard for her. So I suppose wherever possible, obviously, at a caravan park on a football oval, you're never going to be able to control that. That's just what's going to happen. But if you are at a scene where you can remove some of those people, if you just at perhaps a normal scene as such, where there's the ability to remove those people, I think that's really important. I think it's something that perhaps in getting, something like getting a team manager early, if you had a car crash, for example, so that they can control that side and move those people away, it can make a bigger impact to the family on scene, particularly than you as a paramedic would ever realise, or certainly than ever I would have realised or thought of. I'd purely only ever thought of that from a scene control perspective before, rather than from an emotional patient and family perspective, which I now have a very new and improved insight into. And the other learnings would just be, I suppose, about how important that support is afterwards, after such a big event, after a life-threatening event. And going through that. My mum and my husband knew how sick I was. My brother was also there on scene because he drove my husband in, because my poor husband had been quite sick himself the day before, not life-threatening sick, but he was vomiting, so he wasn't doing his best. And my brother has no medical experience at all, none. Whereas both my mum is a nurse and my husband knows, you know, just bits and pieces from me, really. But my brother has absolutely none. And I spoke to him just last week, and he still said, you know, I was speaking about how lucky I was that the helicopter was available and that everything went right, and that he wasn't driving me to the hospital, which was my original plan. And he just said, oh yeah, you are lucky, and you're lucky the helicopter wasn't on another job that was more serious. And I said to him, well, what do you mean by more serious? And he said, well, someone that was more likely to die than you. And I was like, oh, okay. So I didn't correct him, because for him, in his mind, that's quite nice to not realize how sick I was. So I didn't correct him, because I don't think it's necessary for him to have that information or that knowledge. I don't think that would help him at all. But it just made me realize that sometimes at a scene, people still aren't going to understand the severity, and in a way that's nice for them and their emotional ability, especially if everything turns out right, I suppose. If things don't go as badly, it might be more unpleasant of a shock. But I suppose it's a difficult line on a scene to know how much of the seriousness to share with the patient and their family. But I'm a huge believer in always just being honest and upfront and telling them exactly what's going on. I think that's really important. I think it's what the patient and their family deserve, to actually have a proper understanding of what's happening. And I truly hope that I never have another ectopic pregnancy, although unfortunately the odds are increased once you've had one, I've been told. But I also hope to never go to a woman having an ectopic pregnancy, just because, I mean, yes, if I do, that's fine. I'll be able to treat it clinically, but it's such a huge thing to go through. So it's more from an emotional perspective that I truly hope it doesn't happen to anyone else. But obviously that's not reality. It is going to happen to people, and that's just how it is.
That's really amazing insight. Thank you for sharing that. And Darren, I know you're a man that likes to reflect, as we talked about in the past. Was there anything that you took away that was a bit different in this case at all, that will impact your future care for people?
Well, I guess it's interesting. I'll take us some stuff away from the podcast about involving the family a bit more, just hearing that side of things. I'm fascinated by the comments regarding ketamine intranasally. I do subscribe to the reflection thing, and the note, I actually looked at my note that I wrote about Jess's case the other day, is not to make assumptions. And the assumption that I made when I heard the ambulance had turned around and was going back to an urgent care facility with a nurse in it. As I said, I think in isolation, that didn't sound like a great idea to me. But in reflection, I think it was probably a life-saving decision. So kudos to the people, and also big kudos, obviously, to the nurse. And I think the other part of it is to, we have the ability to care for people in our organisation. So making sure that you extend that level of care to people when it is one of our own. I think it's not a particularly big deal for me to get on the radio and say, can we make sure we get a manager at Geelong Hospital, and making sure that the appropriate people are informed with, obviously you need to be sensitive to privacy, etc. But, I think it would be nice to know that Jess has got somewhere there, got her eye on her back until her parents get there and take over. And that would be one of the things I think that that I'm really pleased that we took the time to do. And, the other positives were that just from my point of view about just continuing to keep Jess informed all the way through. So I can tell there was, I knew that this discussion would be interesting, because I'm not sure how much you remember given the amount of drugs she had on board. So there would be things that you would remember, things that she wouldn't. But she was informed that she had blood in her abdomen. She was informed that her blood pressure had been dangerously low. She was informed that we're going to start red cell concentrate and try and eliminate crystalloids in a resuscitation. I told her that I couldn't take her mum or her husband. And, just continuing to update her on the obs. I think that's the positive. And as Jess says, it just reinforces to me that that's important information for people. And they'll soon let you know if they don't want to hear it. But I just think it's a really great perspective. And as paramedics and student paramedics and people learning their trade, we often are very focused on the information that gets before us, and we don't take enough of that into account, in my opinion. So this is a wonderful opportunity for people to hear the other side.
Absolutely. And Jess, if there's one thing, I guess, that you'd like for students to, who are, maybe in their final year or even starting out, is there one thing that you'd like them to take away from your story and your experience?
My biggest thing actually isn't so much from a paramedic perspective, it's from being a patient that is a paramedic, which is to not be afraid to need your colleagues' help. I was so worried, like looking back at the time, I was so worried about having an ambulance in case it wasn't necessary and tying up that resource. And looking back on that, that just seems so ridiculous. We go to so many patients that you could argue potentially didn't need an ambulance. And that's a huge part of our job. Like, that's what we do, especially for the ALS paramedic. Those people, like, the majority of them do still need an ambulance. Maybe they don't need emergency life-threatening care, but they've called you for a reason. And most of the time, I think most paramedics are okay with that because it's such a huge part of what we do. Like, that is what we do. That's our bread and butter, dealing with people that are unwell and need us but aren't necessarily a life threat. Like, we do way more of that work than we do of the critical work as ALS paramedics. And I was so worried about the judgment that they would have on me if it was just gastro. And looking back on that, that seems ridiculous. Like, I was willing to potentially risk, getting that urgent life-saving care that I needed because I was so worried about that. And as a paramedic, like if another paramedic called me and that happened, I would never be judgmental of them, like never ever. So I'm not quite sure why that was so stuck in my brain, but it really was. And I guess the other thing is to do your best to stay on top of those cases that we hardly ever go to. We hardly ever go to obstetric emergencies, but when you do, I think you need to at least know your guidelines, especially as a student perhaps, but also for paramedics, because that can help you feel calmer in a situation where you feel a bit out of control, because it is hard dealing with something you've never seen before. And of course, you're going to make mistakes. That's just life. But to stay on top of those basic things, or even to do with, blood pressures and heart rates and things, even if you're not completely understanding exactly what's going on because you haven't been to it before. If you're on top of those basic things, then hopefully you can still make correct clinical decisions. I know for me, very recently, there was a diving related incident near where I live. And I was like, oh goodness, like what would I do if I went to that job? I've never been to a diving related incident. And I was like, what is that guideline? I haven't looked at it for ages. And so I went and looked it up. And I think that's important, that type of just when you hear things going, oh, I better look that up. I haven't read that for a long time. Just so that hopefully if you do go to it, you've got that background in your mind of like, oh, I think of this. Of course, you've got your app to be able to check, and I encourage everyone to always do that. But yeah, to have that, and also just to have that emotional compassion, I suppose. You've always got it for your patient. Well, hopefully you've always got that compassion for your patient and for their family. But it is a little bit different when you've been on the other side of it. And to be aware that the person that you're working with, you have no idea what life experiences they've gone through and what jobs might impact or affect them more than others. So for me, I can very openly say going to cancer patients is hard for me because of Dad. And I don't know about going to pregnant patients. I guess I'll have to wait and find out if that will be a trigger or not. But to look after that, to look after your mental health, and to know that the job will change you. How could it not? Like, of course it will change you, but not just what happens at work will change you, but what happens in your personal life. Like, my personal experiences are now going to affect the way that I work and my job. And to just be aware of that, I suppose, I think it's important. If you accept that and get on top of it early, like, that's much better than thinking, oh no, it's not going to affect me. Because of course it will. Of course what you go through and what you see will affect you.
Absolutely. Thank you for sharing that. And I'm mindful of both of your times. So Darren, is there anything you'd like to finish off on, anything you'd love students to take away from what you've learned as well from this?
A little takeaway message I'll give your students, and something that a mentor of mine gave me many years ago, and I made this comment to both Jess's mum and to Jess's husband, is that when you are dealing with people that are such emotionally distraught, they clearly have an insight that their daughter and wife is very unwell, and we're taking them away, is I always make a promise to people in that setting that I promise you I will look after Jess like she was my daughter, or whatever, however you need to contextualise it. So Jess could easily be my daughter in her age bracket. So to say that I would look after her like, oh, she was one of my own, or she's my daughter or my sister or whatever, I think, or I hope that is reassuring to people. And I only say that I'm being very genuine when I say that. So, I did look after Jess like, she was one of mine, because she is one of mine in the context of being a paramedic. But if she wasn't a paramedic, I would still make that statement to her family and friends, and I can only hope that that's reassuring to them.
That's great. Well, thank you so much for both of you coming on and sharing your sides, and really appreciate it, and hope our listeners get some great benefit from this, and I'm sure they will. I definitely have. So thanks for listening to this episode of the Student Paramedic Podcast. You can connect with us on Instagram, Facebook, Twitter, or you can email us at thestudentparamedicpodcast@gmail.com.